So when we talk about the diagnosis of coronary artery disease in women, so women commonly present with atypical symptoms. For example, they'll complain of an uneasiness, a feeling of something not quite right, an atypical kind of a discomfort. So it's very important that we should have a high suspicion for coronary artery disease in women. So when we talk about doing the tests for investigating them, the ECG, which is the first test that we do, has more of non-specific changes when you look at ECG of women. Then the treadmill test has a low sensitivity and specificity as compared to men as their counterparts. So the sensitivity and specificity would be about 60 to 70% only in women. So that leaves a wide margin of doubt. So we go ahead for the stress echocardiography. Again, that is a cumbersome test, and it's also associated with a lot of inter-observer variability. That brings us to the CT angiography, and that actually is a very good tool because it has a very high negative predictive value, which helps us to make a diagnosis of whether this patient does or does not have coronary artery disease. And of course, finally, we have the invasive coronary angiography, which of course is the gold standard both in women and in men.